I've been injecting fillers for over 15 years. I started injecting collagen in 2001, and at Cosmetic Skin and Laser Center, we've offered pretty much every FDA-approved filler since then. Initially, dermal fillers were mainly used to fill lip lines and turn the corners of the mouth upward, and to soften the nasolabial folds. But over time, fillers got better, and so did injection techniques. Now, we use them to soften pretty much any line or wrinkle on the face. Lots of filler is now used to add small amounts of volume to help maintain a youthful, rested facial shape. As we age, we naturally lose volume under our eyes, leading to hollows and circles. We lose volume in the cheeks, which causes them to flatten. The temples sink, and your jawline becomes undefined, oftentimes blending right into the neck. You may have heard of the injectable facelift or voluma lift. That's what they're referring to. Basically, we use fillers to tent up and lift the skin. And we use fillers in the hands too, to get rid of that bony and veiny look. The most common types of fillers are made of hyaluronic acid. Common brand names you may have heard of are Restylane Silk, Restylane, Juvederm, and Perlane. These are softer fillers. We use them to correct under-eye hollows, soften lines and wrinkles, as well as correct the downturned mouth. The fillers last anywhere from 6 to 12 months the first time you get them, but many of them have been proven to stimulate your own collagen, and that really prolongs the effect. So once you inject a wrinkle a couple of times, it'll probably be diminished for like 18 months. The hyaluronic acid fillers also come in thicker products that are good for lifting, particularly in the cheeks and the jowl area. The most common ones are Juvederm Voluma and Restylane Lift. Not only do they provide more lift, they last up to 2 years. There's one other product for lifting. It's called Sculptra, and it's a Cosmetic Skin and Laser Center favorite. Unlike the fillers, it doesn't give instant results. Instead, this product works over time by stimulating your own collagen to produce a lift around the eyes, the temples, the cheeks, and all along the jawline. You have to be a little patient because the results take a few months. But for the client who wants to maintain their youthful, rested appearance for years to come, I highly recommend it. It takes a skilled injector, and I'm proud to tell you we are the top Sculptra provider in Michigan, and most of us here have Sculptra. Just like people worry about overdone lips, they worry about overdone cheeks. If I had $1 for every time someone told me they don't want big lips or big cheeks, well, I'd still be here injecting, because I love it. But you get my point. We know you don't want ridiculous lips or big fake cheeks. Don't worry, all of us at Cosmetic Skin and Laser Center have fillers, and I bet you'd never notice. Good technique just makes you look more rested, relaxed, less tired, and less mad. Bad technique, or too many injections in the wrong place, make people look done. That's not our thing here. We're not into big lips or big cheeks either. It seems a lot of patients have some horror story about how painful their friend says filler was. That's old news. The newer fillers have anesthetic lidocaine mixed in with the product, so pain is about half of what it used to be. And an experienced injector definitely makes the procedure more comfortable. I never have anyone say, "Stop, this is hurting too much." We can also use a topical anesthetic and ice, and that numbs the skin too. Fillers take anywhere from about 10 to 30 minutes, depending on how many areas we're treating. And after the injections, we expect some swelling for the first couple of days, especially in the lip and eye area. Most of the time, if you have bruising, it covers well with makeup. And if you stop Advil, aspirin, fish oil a few days before your treatment, your risk of bruising is much lower. But obviously, we recommend not doing injections right before a big event. I'm a good example. I had 3 syringes of filler a few days ago, and if you look closely, you might see a bruise on my left cheek. I always say that people spend a lot of time planning their filler injections the first time. And subsequent injections honestly just become part of a normal day. It's nerve-wracking the first time, and then our clients realize it just isn't a big deal. One more thing. Everyone wants to know how much it costs. Now, obviously that's individual, but I will say this. 1 syringe of filler just isn't very much. If you just want to plump up thin lips or soften a couple of lines, 1 syringe is fine. But when we want to smooth the nasolabial folds or lift the cheeks or correct these marionette lines, we definitely need more. It's common to use 3 to 5 syringes at one time, so if one of us is recommending more than 1 syringe, don't be alarmed. The more material we have to work with, the better your result.